I'm Kara Rex, and this is my informative speech. Imagine waking up in the middle of the night to check on your child only to find out that they have stopped breathing. You have no idea what has happened and have gone into panic mode. The doctors are unsure what the cause of death is, and you begin to wonder what you've done wrong. Sudden infant death syndrome, or SIDS, is the leading cause of death among infants in the United States today and affects nearly 4,000 children each year, according to the Centers for Disease Control and Prevention. SIDS has more than likely affected either yourself or someone that you know that is close to you. Before I was born, my father lost who would have been my older sister to SIDS at 1 month old. Although many call SIDS a mystery, research has proved that there are known risk factors and preventative measures that can be taken to prevent this tragedy. While the title makes a pretty accurate description of itself, SIDS is a much more in-depth incident. The American SIDS Institute defines SIDS as the sudden death of an infant under the age of 1. While the death may be sudden, the cause of death is not ruled SIDS until an investigation. After a thorough autopsy, examination of death scene, and review of clinical history comes up inconclusive, the infant's death may be ruled SIDS. The Mayo Clinic reports SIDS as the unexplained death, usually during sleep, of a seemingly healthy baby. It may also be referred to as crib death. It also reports that SIDS may be associated with abnormalities in the portion of an infant's brain that controls breathing and arousal from sleep. Certain sleep environments can be considered a cause for SIDS, as well as many other risk factors. The Mayo Clinic lists 2 types of factors that can make an infant vulnerable to SIDS: physical and sleep environmental factors. Physical factors include brain abnormalities, low birth weights, or respiratory infections. Sleep environmental factors including sleeping on the stomach or side, sleeping on a soft surface, or sleeping with parents. Physical uncontrollable risk factors for SIDS including the sex, age, race, and family history. Baby boys are more likely to die of SIDS. Infants are most vulnerable when they are 2 to 3 months old. Black, American Indian, and Eskimo babies are more likely to be exposed to SIDS. Although there is not a direct genetic link as of now, babies who have had siblings or other relatives die of SIDS are at a higher risk for developing SIDS. According to kidshealth.org, there are maternal risk factors that can increase the likelihood of a child developing SIDS. Smoking, drinking, and drug use are high risk factors. Poor prenatal care, mothers younger than 20, and premature and low birth weight are other risk factors. After birth, tobacco smoke exposure, overheating from clothing and bedding, and stomach sleeping are also potential risk factors. While these risk factors are scary, there are preventative measures that can be taken to decrease the risk of a child developing SIDS. Many preventative measures stem from sleeping habits for infants. The American SIDS Institute recommends that you put your baby to sleep while resting on their back. This allows for better breathing. When selecting bedding, use a firm mattress and avoid using bumper pads or pillows. Fluffy toys and stuffed animals can also interfere with bedding. Infants should also sleep alone rather than with parents. Adult beds are not safe for babies. They can be trapped between the headboards, the bed frames, and the wall. These incidents can affect breathing or suffocate the child. The Mayo Clinic suggests that you should not overheat the infant. To prevent this, you can use a sleep sack or clothes that do not require extra covers. If a blanket must be used, it should be lightweight and tucked into the foot of the crib and only be able to reach up to the child's shoulders, just like this. Breastfeeding and pacifiers can also surprisingly reduce the risk of SIDS. If the infant breastfeeds for the first 6 months of their life, they are least likely to develop SIDS rather than being formula fed. Sucking on a pacifier before bedtime and nap time will also help reduce the risk. SIDS is very real and has very scary symptoms. However, there are many prevention methods that can assure that your baby is less likely to develop SIDS. During pregnancy, smoking, drugs, and alcohol and poor prenatal care can increase the risk. There are unpreventable factors such as gender and race that can increase the risk. However, safe sleeping habits can decrease the risk. Whenever you are babysitting or taking care of a child next, follow the procedures for getting them to bed and double check them to make sure that they can sleep safely. This is a frequently occurring syndrome that can help be prevented. Simply being informed could save the lives of many infants.